Rock the raincoats without the stormy weather. Let's say I would, only thing is that it feels better. Way before Dirt McGirt was 3 letters. Raw was the law of the land, not just a fetish. So I dare anyone try to compare that skin on skin bare back to industrial pack latex. I'm in the contact, pulling out without using hats. Use a lifestyle, even though that ain't my style of life. In fact, truth is we all fall victim to temptation. Hey, what's up, guys? This is Dr. Enoch Cote, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. In this video, I'm going to talk about some of the most common sexually transmitted infections and diseases that we see in the clinic, as well as explore the concept of condom use to the lack thereof in modern society, drawing off of your insights and hopes of coming up with some sort of a conclusion that can help us take steps towards lowering these STD rates. So stay tuned.
So who knows what this is? Chances are you all know exactly what it is, but not everybody's using one. But just like many other things in life, it's complicated, right? Now, the point of this video is not to pass any sort of judgment or preach to you about safe sex. Basically, I just want to take the insights that I've heard from you guys in the past and work together to come up with some sort of solutions to the issues that we face today surrounding condom use, safe sex, and these rampant STD rates. But before we go into that, let's actually talk about exactly what we're trying to avoid.
Chlamydia and gonorrhea are not just the most common sexually transmitted infections in the United States, they're actually the most commonly reported transmissible infections in the country, period. They're both bacterial infections that grow in the genital tract, anal region, and less commonly the throat. I group them together because they cause similar symptoms and are often discovered together in many patients. In men, the most common symptoms are discharge, which is a thin or pus-like liquid coming out of the penis by itself, burning sensation when peeing, and a painful swollen testicle when they develop a condition called epididymitis, which is an infection of the cord that attaches to the testicle. When the anal region is infected, it can cause rectal pain and bleeding. Throat infections cause soreness. And believe it or not, these infections can also cause a certain form of arthritis as well. When women are infected, it causes discharge from the vagina and burning when peeing. Many infected people can present with no symptoms at all, only to have it diagnosed during a routine screening. However, it's very important to diagnose and treat. First, from a public health standpoint, these infections are commonly spread by someone who is unaware that they are infected. Second, these infections can lead to some dangerous complications if they go untreated for a long period of time, especially in women. Infection can cause a condition known as pelvic inflammatory disease, in which a woman's fallopian tubes can get inflamed and scarred up, leading to severe belly and pelvic pain and place them at risk for infertility. The rates are the highest for both infections in the age group of 20 to 24 years. Chlamydia infection rates are higher in women and gonorrhea rates are higher in men. Blacks have much higher rates than any other race or ethnicity. The main risk factors for infection are multiple sex partners, new sex partner, previous history of any type of STI or STD, aged less than 25 years old, low socioeconomic or educational status, and inconsistent condom use. Men who have sex with men also have high rates as well. As of 2017, the cities with the highest combined chlamydia and gonorrhea rates per capita were St. Louis, Philadelphia, Montgomery, Alabama, Jackson, Mississippi, and Richmond, Virginia. From 2000 to 2011, the rates of infection for chlamydia increased year by year, then slowed down from 2011 to 2013. But as you can see, after that, they picked up again. So I guess it's not just my clinic, but the rates overall appear to be increasing for many different reasons, and we're going to explore those.
Lack of education and awareness. Now, sometimes I find myself assuming that by the time a person has reached a certain age, that they've had an adequate amount of sex education and know about all the different sexually transmitted infections and diseases that are out there. However, after spending time with patients young and old, I'm realizing that this is not the case at all. For example, some patients think that things like birth control pills and PrEP, which is a pill that we use to prevent HIV, can protect against infections like chlamydia and gonorrhea, which is not the case at all. The only things that protect against chlamydia and gonorrhea are correct and consistent condom use, just getting tested and treated so that you can avoid the spread, and also abstinence, which might be a little bit difficult to push at this point. Now, the biggest elephant in the room is the lack of condom use. For those who are married or in a long-term committed relationship, you would expect there to be a lower percentage of condom use. But even for those who are having multiple sex partners or casual sex, I've been surprised by the low percentage of people who report using condoms 100% of the time. A health statistics report released in 2017 by the CDC and Department of Health and Human Services showed that in adults aged 15 to 44, 24% of women and 33% of men reported condom use during their most recent episode of sexual intercourse in the past 12 months. 18% of women and 24% of men used a condom 100% of the time. Of the women that used condoms within the past 4 weeks, 26% stated that the condom was used for only a part of the time during intercourse. So at this point, let's put some things out there that mostly everybody should be able to agree on. If you have multiple partners or are having casual sex, condom use should be 100% of the time. And one of my contributors also stated this. The rates are just way too high. And even if you use condoms most of the time or some of the time, it only takes one unprotected encounter to transmit things like chlamydia and gonorrhea, but also things that do not have a cure like HIV. Infected people don't look a certain way, so just because somebody's attractive or looks clean doesn't mean that they couldn't have any sexually transmitted infections. What some people do when they start dealing with a new partner is that they actually either separately or together go ahead and get tested and then share their results with each other just to make sure they're both free of any kind of sexually transmitted infections and are not at risk for giving anything to each other. In terms of why people don't like to use condoms, I've heard it all. A lot of men and sometimes women complain that it just doesn't feel the same. And this may be true because you got an extra barrier between skin. As one poster mentioned, humans value pleasure over consequences. But at the end of the day, you gotta look at the bigger picture of not getting hit with something that can affect your health just for a few minutes of extra sensation. Plus, there are tools at our disposal to help you with this. You have different brands of lubricants and condoms that are designed to be thinner so the man can feel more, and extra ribbing and contouring to increase the sensation in the vaginal walls. So people have thought about these things. She's on the pill. Sometimes young people get too bogged down with worrying about avoiding unwanted pregnancies that they lose sight of the fact that this is actually the least of the problems when things like sexually transmitted infections are involved. Plus, it's also important to reiterate to them that birth control pills don't actually protect against infections like chlamydia and gonorrhea. Access to condoms. For one, they can be expensive, especially for those who are economically disadvantaged. Also, when you go to the drugstore, you can see that they're usually locked up securely because they are a prime target for shoplifters. But in effect, this discourages people from buying them due to a lack of discreetness. If this is a factor for you, keep in mind that most community health clinics and local health departments give away free condoms, so don't be afraid or too shy to ask. The role of entertainment and media. Now, this is something that I feel like I noticed myself. But back in my day, when I was growing up in the early 90s, I remember watching TLC videos when Left Eye wore the condoms on her face and on her clothes, or the Ain't Nothing But a G-Thang video where Snoop went into the bedroom with a bunch of ladies, but at least Dr. Dre made sure he was strapped up. I also remember on Boys in the Hood, R.I.P. John Singleton, the father and the son convo between Trey and his pops about the importance of condom use. But I feel like today that rhetoric is a lot less prevalent in entertainment, even in some of my favorite shows. In Atlanta, you have the scene where Van is on a girls' night out with her friends, and when condom use comes up, she says, "How old are you? You're still using condoms? Are you in high school?" Or even in the show Insecure, there have been multiple sex scenes in which condom use was not even suggested. Now, I know that in the early 90s, there was more of a push to raise awareness about the HIV epidemic, and entertainment played a role in that. But if we as a society become unrightfully lax on that effort, what I would like you to do is drop a line below and let me know what you think. Am I reading too much into something that's just a show? Or were these deliberate moves that conveyed a general tone and sentiment of how young adults feel about condom use today? Other reasons for lack of condom use that I hear are latex allergies. Just keep in mind that latex-free condoms are available in just about every drugstore. The condom broke. It's difficult to know how often this truly does happen. I'm not sure if some patients are just saying it to come up with an excuse, but it does happen sometimes, and usually the things that make it most likely are the use of 2 condoms at the same time, which can create extra friction, use of harsh chemicals and lotions that aren't water-based lubricants on the surface of the condoms, using expired condoms, and mishandling of the condom, whether that means opening the package with scissors or teeth, and the failure to leave enough room at the tip so that semen can be collected without creating extra pressure at the tip. Inability to negotiate condom use. In a world where human trafficking and intimate partner abuse are just as rampant as ever, it is our job as a society to pick up on social cues and say something if we see something. But this is a situation where female condoms can play a role because a woman has more control over that. Now, just a word to married and committed couples. I have diagnosed plenty of sexually transmitted infections in those cases. A lot of it may be due to infidelity, or somebody maybe just didn't get tested before they got into a relationship, so they carried something and then they ended up transmitting it to their partner. But the main thing that I want you to take away from this video is that when you go to the doctor, don't get offended, or please don't be hesitant when sexually transmitted infection testing is offered, because it is important for you to keep up on it as well, just because you never know. Nobody wants to think that they're in a situation where that would be something they will be at risk of, but you really just do not know in a lot of cases. And it's not really showing a sign of distrust towards your partner, but it's just something that is recommended in general and something that also does not hurt. The other thing that we need to all agree on is that everybody should get tested, because first of all, a lot of these infections don't cause any symptoms at all, and plus, diagnosing people and treating them is our only hope for actually lowering these STD rates.
If you enjoyed watching this video and would like to see more breakdowns on other medical topics, make sure you subscribe to Trust PCP. Thanks for watching, and peace out.